So stage 3 is the important stage. Remember, we said that's the baseline because it's not going to get better. It's only going to progress from there. So when the stage 3, it's documented in the chart, and it just says patient has stage 3. Now for 2021, stage 3, it has so many parts to it. If they only say stage 3, that means it's going to be unspecified because the stage inside of stage 3 is not specified within the chart. So here we go. Let me show you. So if it's documented in the patient chart that the patient has CKD stage 3, then you're going to use N18.30, which is stage 3 unspecified. Stage 3, the GFR is between 30 and 59 for stage 3. So, here's another new code. Now for 2021, there's a stage 3A. And that GFR is between 45 and 59. If you're reading in the patient's chart, you see the patient lab, you query the physician. If the GFR is between 45 and 59, they should document that this is stage 3A. And you should use the code N18.31. Then there is a stage 3B. Stage 3B, that's the GFR of 30 to 44. eGFR of 30 to 44, stage 3B, and that code is N18.32. So the 3 new CKD codes for 2021, N18.30, stage 3 unspecified, N18.31, stage 3A, and N18.32, stage 3B. So stage 3 CKD has several parts to it for the 2021. So those symptoms of CKD stage 3 is going to include swelling of the hands, the feet, back pain, and it might have frequent or less urination than normal. So stage 4, you're heading to renal failure. You're heading there. So stage 4, your eGFR is between 15 and 30. See how the numbers are getting lower, but the stage is getting higher and more serious. So stage 4 CKD, your eGFR is between 18 and 30. And they take this very, very, very serious because this is the last stage before failure, which is stage 5. Stage 5 is the initial, primarily the last stage, and then you have stage 6, which is your end stage renal failure, where your kidneys has failed. There's no more stages. So stage 5, your eGFR is less than 15. You're close to failure and have completely failed altogether. And your waste builds up in your blood. And normally when you get to stage 4 and 5 and 4 and beyond, then you're on dialysis. And remember, if it's documented that the patient is on dialysis, you're going to use Z99.2. So when you look in your book under N18 in your ICD10 book, it'll say chronic kidney disease. It'll say that. And it'll also tell you to use the code for dialysis. And it also tells you about other things that might be inclusive, like hypertensive CKD, and how to code that. And we'll talk about that as well. So, like I said, dialysis typically starts around stage 4. And this is a process which helps clean your blood when your kidneys have failed. So we're going to talk about 3 different types of dialysis. Let's talk about hemodialysis, and that's the most common. And you think about that is hemodialysis, it operates as an artificial kidney. It's like a hemodialysizer, that's what they call it. And it removes your waste and fluid from the blood. The blood is removed from the body and then is filtered through the artificial kidney. The filtered blood is then returned to the body with the help of the dialysis machine. And this is to get the blood to flow to the artificial kidney. Your doctor will perform, to get the blood to flow through the artificial kidney, your doctor will perform surgery to create an entrance point. And they call it like a vascular access into your blood vessels. So there are 3 entrance points We're going to talk deep about dialysis, CKD, and things like this in this video. So there are 3 entrance points, and there are important CPT codes to this because this is a procedure, and these codes will come out of your CPT book. You have an arterial venous fistula, and they call it an AV, and it connects to your artery and a vein, and it's the preferred option. Then you have an AV graft, and this type is a loop tube, and then you're going to have a vascular access. It's a vascular access catheter, and it may be inserted into like the large vein of your neck. So both the AV fistula and the AV graft are designed for long-term dialysis treatment. So remember, we talked about the different types of dialysis. We talked about hemodialysis, where, normally the people go to the dialysis center 3 times a week, get hooked up to the machine, hemodialysis. So we also have peritoneal dialysis. And this involves surgery to implant a peritoneal dialysis catheter into your abdomen. And they call it a PD, peritoneal dialysis catheter into your abdomen. So during treatment, a special fluid called dialysate flows into the peritoneum. And the dialysate absorbs the waste. And once the dialysate draws waste out of the bloodstream, it's drained from the abdomen. So that peritoneal dialysis, make sure you look this up as well to also get a better understanding. Peritoneal dialysis, hemodialysis, we talked about this. Now, peritoneal dialysis takes a few hours and needs to be repeated 4 to 6 times a day. Remember, we talked about hemodialysis, where there's like 3 times a week. So peritoneal dialysis needs to be repeated about 4 to 6 times a day. However, the exchange of fluids can be performed while the patient is asleep or while the patient is awake. So they don't have to be awake for this 4 to 6 times a day. They can be asleep. So there are numerous types of peritoneal dialysis, and these are the main ones. So look these up too when you're getting a better understanding of CKD, dialysis, and all the intricate parts that comes with this disease. So you're going to have CAPD, and that's continuous ambulatory peritoneal dialysis. You're going to have continuous cycling peritoneal dialysis, which is CCPD. And then you're going to have intermittent peritoneal dialysis, IPD. Again, continuous ambulatory peritoneal dialysis, continuous cycling peritoneal dialysis, and intermittent dialysis. You're also going to have continuous renal placement therapy. So this is a therapy that's used primarily in the intensive care unit for people with acute kidney failure, also known as hemofiltration. So I want you to know about continuous renal treatment therapy as well, CRRT. So I want to talk about also 5 types of kidney failure. So let's talk about acute pre-renal. Remember, we talked about renal means kidney. So acute pre-renal kidney failure. That's when it's insufficient blood flow to the kidneys and can cause acute pre-renal kidney failure when you have insufficient blood flow to the kidneys. Acute means something that's, you have acute and you have chronic. Chronic is a long-term condition that you're going to have over a period of time. Acute is something that just all of a sudden happens. So then you're going to have acute intrinsic kidney failure. And this can result from direct trauma to the kidneys, such as physical impact or an accident. And the causes also include toxin overload and ischemia. And ischemia of the kidneys is just a lack of oxygen to the kidneys. So then you're going to have chronic, remember, have acute and chronic. We're going to have chronic pre-renal kidney failure. And that's when this isn't enough blood flow to the kidneys for an extended period of time, and the kidneys begin to shrink and lose the ability to function. And that's chronic pre-renal kidney failure. And then you're going to have chronic intrinsic kidney failure. And this is long-term damage to the kidneys due to intrinsic kidney failure. We talked about acute intrinsic failure. So intrinsic kidney failure develops from like direct trauma to the kidneys, like we talked about, such as severe bleeding. or lack of oxygen. So you're going to have acute intrinsic or you have chronic intrinsic. And then you're going to have chronic post. Post means after. We know pre means before and post means after when you know your medical terms. So chronic post-renal kidney failure is when you have long-term blockage of the urinary tract and it prevents urination. And this causes pressure and eventual kidney damage, build up of pressure, and it damages the kidneys. So let's talk about hypertensive heart and CKD with heart failure in stages 1 through 4 CKD or unspecified CKD. So that's going to be code I13.0. Let me go to that code because I want to tell you something. I don't want to just talk about it. I want to be able to show you. So I am going to go to I13.0. So when I go to I13.0, the code for this is hypertensive heart and chronic kidney disease with heart failure and stage 1 through 4 chronic kidney disease or unspecified kidney disease. So inside the note, always read your additional notes, and it's in red so you can't miss it. This is how you're going to code it correctly. It also tells me as instructions, use code to identify the heart failure. It's telling me inside this code I13.0, I'm also going to use a code to identify the type of heart failure. And it's telling me it's going to come from the code set of I50. Then it's telling me to use the additional code to identify the chronic kidney disease. It's telling me to use stages N18.1 through N18.4 or N18.9. You see it skipped over N18.5 and N18.6 because specifically in the code I13.0, it says chronic kidney disease with heart failure stages 1 through 4 CKD. So that means I can only use the 1 through 4 stages to identify the CKD. And if the level or the stage of CKD is not specified, it's telling me to use N18.9, the unspecified CKD code. So, also, when you're using the diabetes code with diabetic CKD, E11.22, there are special instructions for that as well. So let's turn to our books to E11.22. And I want to show you something here too. So when I go to E11.22, we all know that E11 is type 2 diabetes and E10 is type 1. If you don't, now you know. Anytime it's coming out of the E10, type 1 diabetes, E11, type 2. So E11.22 is type 2 diabetes with diabetic CKD. When you read the red instructional note, it says, code to identify the chronic kidney disease stage. It says N18.1 through N18.6. It does not tell me N18.9. It does not give me that. So that means if it's unspecified in the chart, then you have to query the doctor. When you're using E11.22, you're going to have to ask them what stage. Because you're going to have to identify the stage. And N18.9 is not an option. So we can't use the unspecified stage when you're using E11.22. So E11.22, you're not going to use N18.9 with that together. So also, when you're using E11.22, you're going to code if the patient is on long-term insulin. If the patient is on long-term insulin, as a rule, as an instructional note, it's going to tell you to notate that with your status code, your Z codes. You're going to use Z79.4. If you're reading the patient chart, they are on insulin. Not being described insulin that day, but already on insulin prior to that appointment. Then you're going to use Z79.4. If they're on oral anti-diabetic drugs, you're going to use Z79.84. E79.84. So these are the new CKD codes for 2021. Remember, you have N18.30, which is CKD unspecified. Before 2021, we only had one unspecified CKD code, and that was N18.9. Now, if the stage 3 is not specified, whether it's 3A or 3B CKD, then that means the stage 3 is unspecified, and you're going to use N18.30. If it's 3A stage if it's CKD stage 3A, you're going to use N18.31. If it's CKD stage 3B, you're going to use N18.32. And it goes by the eGFR, the filtration rate, and the documentation that the physician put. So thank you so much for joining me. I hope this was very informational for you in regards to your new CKD codes. Don't forget to like, don't forget to comment, and don't forget to subscribe. Also join my social media platforms. I am on Instagram at the coding coach _CPC. The coding coach _CPC. I'm also on Facebook as Dynamic Medical Billing and Coding Group as well. So thank you so much for joining me. If you have any questions, make sure you drop them below, and I'll be sure to get back with you with all of your answers. Again, thank you so much for joining me. Have a great rest of your day.